Good morning. I'm Nancy Osborne. I work for UC as the travel insurance liaison for UCEAP and for Travel Registration and Insurance Services, which is also known as TRIS. TRIS expands access to travel insurance expertise and to information about the resources and services provided under the three UCOP contracted travel insurance policies. TRIS achieves this by developing tools, delivering training, and answering questions from clients, including campus risk managers and leaders of international activities, including study abroad. I'd like to welcome the panelists who will be presenting this session. Tara Specker from Mercer Health and Benefits, Donna Horsch from Chubb, Yanil Pascal from AXA Assistance, and Brian Crowther from Crisis 24. You're welcome to ask questions in the chat during the presentation, and I may respond via chat or we may just hold the questions till the end. Tara, go ahead and please start us off and then hand off to the next presenter when you're through.
Absolutely. So thank you, Nancy, for the introduction. As everyone knows, we're here to discuss the University of California Study Abroad Travel Program. As Nancy said, I'm Tara Specker, a Mercer consultant on the University of California account. Our other three presenters are from companies that put Mercer's advice and solutions into action: Chubb for insured benefits, AXA for medical assistance, and Crisis 24 for security intelligence. UC has a risk management program in place to protect students while they are traveling on study abroad programs. This program reinforces UC's commitment to the safety and well-being of their students. There are three key aspects included: insured coverage, travel, medical, and security assistance, and technology tools. The program provides travelers with the peace of mind that they will be taken care of so they can focus on the trip at hand. In addition to the travel assistance, the service provider also provides valuable information for the travel destination. This can be done prior to the trip and during the trip. The technology tools included in the program make obtaining this information easy for travelers. This also includes real-time alerts for security issues. These three aspects combined equal and comprehensive risk management programs. Next slide, please. There is an absolute stellar team at the university who support this program. The team relies on Mercer as their consultant to make sure the program is running smoothly, and all partners are working together to support the overall program in their respective fields. Chubb is the insured carrier. They are the one who's taking on the risk, and they are the only ones who can interpret the coverage. Chubb will introduce the insured benefits in their portion of the presentation. AXA is the medical assistance provider. They are the first line of defense for a traveler when seeking assistance. Their operation centers are open 24/7, 365 days a year, so they can be available for traveler support regardless of the time zone difference. Crisis 24 is the security assistance provider. They provide intelligence so travelers can be aware of any potential security issues before they travel, as well as any situation that may develop during the trip. And before we go to our next slide, I want to introduce, you can go ahead, Nancy. Donna Horsch. She is the Chubb underwriter on the University of California travel program, and I'll let her explain the insured benefits.
Thank you, Tara. Good morning, everyone. As Tara has alluded, I am an underwriter working for Chubb, and I've been the account manager / underwriter for the University of California for the past 12 years. We provide, insurance for your students, teachers, employees, but what we're going to be speaking about today is specifically for the students who may be traveling abroad for study abroads, research, etc. But I did want to take a few minutes. Nancy, I'm sorry, you can go forward, please. Some of the benefits, I feel everyone might think of traveling abroad, and the medical insurance comes top of mind, and emergency evacuation if someone gets sick. But I did want to spend a couple of minutes to speak about some of the other benefits, which are very valuable to your traveling population. So we provide an accidental death and dismemberment benefit, which includes paralysis. So if a traveler is involved in an accident and they lose their life, there is a principal sum amount that is paid to their beneficiary. If they become paralyzed, dismembered, there are benefits for that. When someone is paralyzed or dismembered, we have other benefits, which we like to refer to as living benefits, meaning the traveler has sustained an injury, a severe injury, and they are going to need some money to, whether it's to revamp their home or vehicle. If they should be in a coma, there's a monthly benefit. If they have a dismemberment and they're traumatized, or their family is traumatized over the death, there's a bereavement and trauma counseling benefit. And also, if someone is involved in an accident in their motor vehicle and they have a seatbelt on, however they still lose their life, there's an additional benefit on top of that. So I just wanted to touch briefly on them. These benefits are payable worldwide, whether the student is traveling domestically to attend some kind of activity that's sponsored by the university, or internationally. So I wanted to highlight those. Next page, please. So the most important aspect of our coverage is to provide insurance for the travelers while they're traveling outside of their home country for accident and sickness medical. It can be for any accident or sickness that develops once they're on their trip. It's payable at usual and customary the charges, and that's where AXA gets involved in helping the students out. Next page, please. And there are a host of additional benefits that are tied to just not the medical bills. As you can see, there's an emergency hotel convalescence benefit, which means if a traveler is hospitalized and the doctor deems them clear to leave the hospital but not travel home, there's money for that person to stay in a hotel room while they continue to heal. Emergency medical evacuation benefit. That is a benefit to take a traveler who's been either injured or becomes very ill to a location that can best take care of them. You may be in an area of the world where you have a heart attack, or there is a heart attack, and there's not a good hospital nearby that can treat your sickness or injury. So you'd be medevaced somewhere that could treat you. Baggage delay, it's kind of self-explanatory. If you're traveling, your luggage is delayed, there's a couple $100 to buy incidentals. An emergency reunion benefit. If the traveler is hospitalized and a doctor deems it necessary to have a family member at the bedside, their traveling costs would be most likely covered under this benefit. Lost baggage benefit, person's traveling, they lose their luggage, they would file a claim for the contents. Personal property is similar to that. Quarantine benefit, if quarantine is instituted there, and the person can't travel, there's some funds that are available for them to pay for lodging. Trip cancellation interruption, I think is an important one. We get a lot of questions about this. Trip cancellation is if a traveler cannot take their trip, they haven't left yet, they can't take their trip because of sickness, injury, death. There's an insurance benefit for that. If they're on their trip and it is interrupted, there is money to get them back home, airline ticket, etc. And a trip delay basically is, you're on your trip and because of weather, you have to be laid over. Again, there's a small benefit for that as well. Next page, please. Oh, I'm sorry, that's the end for me. So as I had mentioned earlier, AXA is a very big partner in conjunction with us providing the benefits. They are there to assist the travelers with pretty much anything they need. So with that being said, we'll hand this over to Yanni Pascal for her portion. Thank you.
Thank you, Donna, and good morning, everyone. So I'm Yanni Pascal. I'm actually the account manager at AXA for the University of California and the rest of the CHUB partnership. So AXA and CHUB have worked together for the last 10 years. AXA is a 63-year-old company headquartered actually in Paris, but our US operations center is in Chicago. So in order to provide those benefits that Donna just described, especially the accident and sickness, we go to the next slide. What we do at AXA is provide the resources and the solutions from when those emergencies or crises come up. So our core business centers around the travel medical assistance. So your team can call, email AXA to open a case, and we will provide you with all of the referrals, the appointments for any sort of medical situations, and we will continue monitoring those cases. Our global network is composed of not only our very own AXA network, but also trusted partners that we have worked with for many years. And those relations continue to be vetted by our corporate team in Paris. Again, our entire network is 24/7. Our US operations center, everyone is English speaking. We do not outsource any of your calls anywhere. And that also allows us to provide you with the best case management. So it can be anything from a simple list of referrals to providing you more details when an actual severe emergency occurs. We also provide, through trusted third-party vendors, remote crisis support and behavioral health. So we use the services of Dr. Please, which I will present to you shortly. And for crisis management, in the event that one of our students need immediate consultation due to mental health and another big topic that's coming up, social anxiety, when they make it to a new destination, is to provide them this remote access to an application where they can schedule their actual appointments and then proceed with having a consultation. If anything escalates to be more severe, then that vendor contacts AXA to let us know to, the recommendation to do follow-up in-person sessions. And in order to provide also our members with some of the medical providers' information, as well as some risk map details or details on the actual location, CHUB has enabled through AXA and Crisis 24 the Access to Travel Eye, which offers intelligence designed to provide the necessary information to 100,000 resources providers, and also details for both medical and security issues. The next slide. So the next slide is going to show you just a quick screenshot of our global footprint. So as I mentioned, the US operations team of AXA is based in Chicago, a 24/7 operations team. They will be the ones managing all of the cases, and if we need to activate any of our worldwide offices, that will be the team that will be arranging that. But all the communication will be coming from our team in Chicago. In Barcelona, we provide the translation services, and then the other major medical center of excellence is based in Paris. The next slide will speak about our international medical and global network. So we currently have medical assistants in about 30 countries, about 300 doctors and nurses that are part of our team. So when these emergencies occur, all the medical records that we received are reviewed by our medical staff. If it's a U.S. Case, right, related to CHUP in the University of California, our medical staff in our Chicago office will be the one providing the review as well as the travel recommendations if a medical evacuation case is being arranged. In total, we have over 1,000 agents that are assisting us to arrange the cases, providing the guarantee of payment anywhere around the world. Again, this is 24/7, 365 days. Also in the International Medical Network side, we work with about 36,000 providers worldwide. And we've worked so far ever since establishing the US office on about 2 million. We have received 2 million calls for medical assistance, about close to, at this point, 900 medical cases, and about 14,000 repatriations. And I will speak to you a little bit more about the journey about repatriations that could take place either in a commercial flight or air ambulances. So up next, just to give you an overview, the outpatient assistance journey. So your member will contact AXA, and one of our agents in Chicago will open a case. We'll use the international network of providers to find a provider or to set the appointment. The agent will communicate this information to the member via email or over the phone. We will also work closely with the CHUP benefit team to confirm the benefits for our member, and we will organize any follow-up visit. If possible, we'll also arrange a house call if needed. That is if it's an outpatient visit. During the call, we also offer our members, if it's for, let's say, a sinus infection, or right now in some of the COVID cases that have been registered, if they would like to proceed with a teleconsultation as opposed to going in person to a facility. So if it's an actual case that we can refer to a teleconsultation, we will provide the access code and the instructions for the member to download the app to access Dr. Please and complete their own booking request or a callback. So teleconsultation is accessible from anywhere and anytime. And it can be accessed by phone or just a mobile application with video capabilities. Prescriptions, so just so you know, prescriptions may be available through Dr. Please, but that is based on the country's regulations. Some countries do not allow for Dr. Please to prescribe and for those prescriptions to be sent to a local pharmacy. If that were to be a situation, then the member can reach back out to AXA, and then we will assist with getting that medication refill taken care of. Like I said, the next slide will speak a little bit about just a quick overview of Dr. Please. So again, it can be accessed anywhere, anytime. There's a remote medical consultation and treatment options. It is available currently in 8 languages via the app or phone with the video option. Our members don't need to enable the video capability, but they're more than welcome to do so. Dr. Please is a very trusted partner. There's interactive consultations. They will upload and display scans, test results, and medical records. That information will only be available to our member. Acts like as just simply a summary at the end of the call, but all the data shared during the consultation is kept with Dr. Please. Any additional information and the specific details of those records will only be shared with the member. Again, this is to provide some peace of mind when our member wants quick answers. It's a fully digital self-care experience. AXA has completed due diligence on the data component to ensure that this information is secure according to our AXA data privacy regulations. And again, all the information that is shared to the member at the end of the consultation is transmitted through their secured portal, and that is through the app. Up next, I will just go over a quick inpatient assistance. So this is right when we have more severe case that have nothing to do with just a medical referral. So in this case, we have Lucy, who unfortunately fell off her bike and is severely injured. She has been admitted at a hospital in Paris. Whether it's the facility, one of the program directors, or the member calling AXA, our AXA team will open the case. Again, the center based out of Chicago will open the case for an inpatient case immediately. Once we open the case, we will make sure to gather information of what hospital Lucy has been admitted. We will get all the details to make sure we continue the medical monitoring. And that way we could continue the communication with your staff as well as CHUP regarding the benefits. Throughout this process, our agent will ensure that Lucy receives the best treatment, and we will keep Lucy informed of next steps. Again, this is also to make sure that we have peace of mind and that your team gets the best information regarding the medical treatment. Those records will be reviewed by our medical staff. That means that any recommendations regarding whether Lucy is receiving the correct treatment or if we recommend moving her to a new facility, all that will be coming from one of our licensed registered nurses or our lead medical director, Dr. Kai, who has about 30 years of experience in the medical field. So our agent will support the program director and Lucy on the next step and retrieving all the key information from the facility. We will also continue the communication, let's say if the family is involved, with the family as well. So all communication is transparent and open. We will place the guarantee of payments with the hospital to ensure that at discharge, the member doesn't have to worry about those out-of-pocket expenses. And then we will reach out to CHUP or the University of California in case that we need to recommend an evacuation. If we don't need an evacuation and Lucy is able to return to the program, we will close the case. If the member decides that she would like to return home, then we will arrange all the transportation as part of the medical evacuation benefit through CHUP. So let's say Lucy's case, on the next slide we'll speak, let's say Lucy's case had escalated to be a medical evacuation, then that's when we will activate our complex team who will be monitoring the case for, let's say, air ambulance needs or commercial flight or commercial stretcher. When a medical evacuation takes place, we want to make sure that we follow the security guidelines established over at our operations department. So what that means is, even if we want to get our students back home as soon as possible, we want to make sure that they're fit to travel. So we will follow up with the treating providers. We will get the latest medical records, have that reviewed by our medical staff, provide our very own travel recommendations, and that will entail asking whether specific medical equipment is needed. If the member needs to be evacuated with medical or without medical escorts. If they need medical escorts, we will ensure that they need a medical doctor or registered nurse, and then we will also provide all the logistics for that. So when we complete a medical evacuation case, we will send, once all the details have been finalized, we will send the complete itinerary to both University of California. The family member will also keep our partners at CHUP informed. I wanted to list, this was just a quick overview, so feel free to ask me any questions at the end of our presentation, but some important travel reminders, particularly for the students. We want to make sure that pre-trip, they see their primary medical doctors or specialists if they're currently under any medications. We want to make sure that they have the medication refills that will allow them to at least be taken care of for, let's say, the first month. If they are in any continued treatments, please have that member contact AXA directly so we can begin either a medication research or medication or a medical facility search. There's some cases that have been open for infusions, and those take some time to arrange. So we want to make sure that prior to the trip, that they obtain the medication that they need, and if they need continued care, that they contact AXA so we can already have that pre-scheduled prior to their arrival. Again, during the trip, if any emergencies happened, they can contact their regular staff on the ground, or the member can contact AXA via the phone or email to open a travel or medical assistance case. We are here, your trusted resource. So it doesn't matter if it's a simple question or they don't know what's currently happened. Open that case, let us know, and let us monitor in case, right, we need to outpatient and simply share them the doctor please instructions, or actually schedule a in-person appointment. And lastly, we want to make sure our students enjoy this once in a lifetime experience. So please rest assured that my AXA team is available 24/7 for any emergencies, and to give you and the rest of the travelers peace of mind. So I will go ahead and pass this on to another dear partner of ours that provides the security assistance. And for that, Brian will be presenting that for you.
Thank you, Yanil. I appreciate everyone's time today. We can move to the next slide. Just introducing Crisis 24 and the duty of care process that we've put in place for the University of California. There are three sort of primary priorities of a successful duty of care program, and that is to educate the travelers about the risks inherent to the destinations that they're traveling to educate the travelers about the safety net that is available to them while they're traveling, very much dovetailing or aligning with the previous slide. And to position the University of California to respond to an event appropriately once it takes place. And there are a variety of different tools and resources and teams in place to provide that appropriate duty of care in support of the University of California's travelers. And part of the role that Crisis 24 plays is really helping individuals gain access to the right resources as they're needed. Next slide. Risk intelligence is the primary offering from Crisis 24. It's delivered from a team of analysts, a global team of analysts that are reviewing both open source and closed source information, reviewing that information on behalf of our clients, then publishing that information out to the clients so that they can understand what the impact of those events are on their organization as a whole. It is supported by AI in the capture and collection of that information, but all of the alerts and incident reports issued by Crisis 24 filter through that analyst team so that the appropriate thresholds and standards are applied before that information is published out to our client organizations. There are obviously stages and degrees and severity and categories of the alerts that come out. But what is most important is that all of that guidance is intended for our clients to understand how events are impacting them as an organization and what actions they can take to mitigate those risks. Next step. Quick global footprint of not just Crisis 24 here, but the Garda operations as well. The significance of this is that Crisis 24 is in place not just for the intelligence services, but also security response services if those are necessary. And the global footprint that we're looking at here on the map really does detail the depth of the bench that we have available to us in response to an event. So when a large-scale event occurs, or when an event occurs that impacts one of our clients, these are the resources that we have available to us to respond to an event, either at the local level or regional or global level as needed. And we'll talk through a little bit as the slides progress about how those resources are utilized. Next slide. we do have a significant global operations center presence, available 24 hours a day, staffed with both analysts and security professional response operation professionals available in the event that our clients need our support, available for monitoring the alerts and intelligence that are being published out, but also providing monitoring of the impact of those events on our client populations. The ability to simply answer questions from a security perspective, that's a really quite a valuable guidance that's available from those resources if it's necessary. If a traveler or a student just feels unsafe, they do have an opportunity to call in and speak to a security professional, talk about where they are, and then receive guidance on the appropriate actions that they can take. And that advice would be available, and it would also come with the guidance if additional resources need to be applied to that situation. Next slide. In addition to the analyst team and the response coordinators available within the operations center, that analyst, the platform itself, the companion platform, also publishes out that information so that the full UC system has access to the intel published, the medical and the alert information that is pushed out to our employees or to our clients, so that they can understand the impact of those events on their own population. So campus by campus, understanding the impact of security alerts, incident reports as they impact their their students abroad, as well as their partners abroad. Next slide. Much of the efforts of Crisis 24 are really focused on those four anticipate, prepare, respond, and recover components. The goal is really to fall in the first two, to anticipate and prepare as much as possible in the delivery of alerts and intelligence in advance, as well as making recommendations and helping our clients prepare, helping UC prepare for the risks inherent to a destination or the likely risks for individuals that are studying abroad. The response functionality, obviously 24/7 availability, highly capable security professionals available to support UC students, but ideally we would be able to address issues before they become significant up where resources need to be provided. And then recovery is often an overlooked element. It helps to feed as a cycle the continuing evolution and engagement within a local operation, right? If a location has a series of let's just say petty crime as an example, petty crime cases, then that should be something that we begin to filter back into the anticipation and preparation phases, right? We want to be able to educate the employee, use that information to educate the student travelers about the possibility of that petty crime. Next slide. A bit of the statistics just across the board on the experience. The 55 years of experience, 24/7 global operations, 1 million calls for assistance, crisis response capabilities, significant AI search, 200,000 sources searched by AI. The net of collection for intelligence was really quite significant, and the ability to leverage AI and supporting that has been really a game changer for Crisis 24 and the analyst team, allowing them to focus on things that we know, events that we know hit our thresholds, but otherwise, due to the time constraints of human review, otherwise would not been able to publish. Next slide, please. The intelligence we've already spoken to. What I haven't spoken to is the use of that intelligence within the operations center to actually call out to personnel as part of the protocols from Crisis 24, to call out to personnel within UC when events occur that affect either the student traveling population or the university as a whole, and to identify, okay, this event is of a certain severity. It has impacted X number of UC personnel or staff or students, and this is our recommended response to this event. And that what that helps do is really shrink the time gap from activation or notification of an event to the response event. We're helping to really turn the page and helping UC in that third requirement of duty of care in responding appropriately when an event occurs. And that obviously is going to be different case by case or event by event, but the opportunity for Crisis 24 to support UC and helping to deliver on that item really has been helpful for the program as a whole. Next up. We'll talk a little bit more about this. But Crisis 24, I mentioned the call outs, but that's a two-way street, right? Available 24/7 to also take on, once we've made a recommendation, and if that recommendation includes activation, the resources that I spoke to as available on that map slide are then available to then be activated. We will talk a little bit about case studies, and there's a variety of options within the slide deck and the recording. But there's a significant capability with regard to response through that global footprint that we've talked about earlier. Next slide. Training is, I mentioned preparation and the anticipation side. This is where Crisis 24 really has been delivering over the past year significant value to UC. And I say that because we have scheduled and or delivered to this point 20 different travel briefings, and I'm sure those on the call are familiar with those briefings and the request process for those briefings. But it certainly has been valuable for our security teams and our response operations coordinators to review the travelers, the list of travelers, who's going, how long will they be there, what are the itinerary details, what concerns do they have going into the location, and then preparing a presentation, roughly an hour briefing about the risks that are inherent and how those travelers might be able to mitigate those risks. That really is a valuable, not just from a Crisis 24 side not just from a UC side to ensure that the travelers are trained, but from a Crisis 24 side to have a better understanding of what the footprint looks like, who those travelers are, and how well prepared they are to travel to and meet the risks inherent to that destination. So very valuable sessions on both sides within the program, and really has been well received by the attendees from the university. Next slide. Investigations and risk assessments. This is part of that recovery component, and sort of feed that feedback loop into the preparation and anticipation side. We've delivered an assessment specifically for Cairo, in Egypt, for the potential return of a program. And that's a good use of the security footprint from Crisis 24 to have on the ground assessment, so that we understand what those resources look like, what the facilities look like, what the on the ground assessment is of those of that campus, to properly set expectations for that program moving forward. Next slide. Behind all of that, and specifically when you're talking about assessments and the standards to which organizations are holding Crisis 24 are all of these standards and credentialing agencies. These are the professional working agencies and groups that Crisis 24 security professionals adhere to and meet and are trained to support. And it's important to note that these aren't just sort of good ideas that a security guy had. These are instead standards that not just the University of California, but all programs need to meet. And we need to make sure that we go out and are supporting UC and their partners in adhering to these policies and standards. Next slide. I do have, I think I just have two case studies to walk through. Different examples, both student population examples, but there was one a change in a law in Hong Kong. I think we're all familiar with the changes in Hong Kong in 2019 that resulted in fairly significant civil unrest and protests and disruption. Crisis 24 was activated, and in the end, we were able to provide 17 ground evacuations for, I believe it was 21 students over a 14-day period. Now, tied with that is not just the performance of the ground evacuation. It's the performance of that ground evacuation as informed by the global intelligence function within Crisis 24. So the process of that 14 days of ground evacuations had actually started well in advance. That was when the protests occurred and when the law was passing. There was significant challenges, and there were information alerts and intelligence that led up to the eventual, okay, the appropriate thing to do is to move these individuals out. And it's important to note that when you're talking about protests and civil unrest and disruption, that those are events that generally escalate over a period of time, and that there are certainly warning signals. And the intelligence capability within Crisis 24 really is highlighted by the way that those types of events evolve. Now, we can counter that with the next slide, which is actually a slightly different event, but a magnitude 6.4 earthquake in Puerto Rico. There were, again, for a university client, this time students and faculty, in a facility. We needed to evacuate those 23 personnel from a remote location following that 6.4 earthquake. Now, both of those events are going to require Crisis 24 leverage their network of providers on the ground in support of those individuals. And in the case of Hong Kong, ground transportation providers, in this case, aviation providers as well. And in this case was actually repatriation of those individuals back to a variety of different locations, not just one single location. But it's important to see the different capabilities within Crisis 24 when it comes to different types of events. There's obviously a natural disaster, and the response there needs to be quick, but needs to be informed from on-the-ground intelligence as to what are the resources available following the earthquake, what is the impact on the infrastructure locally to get individuals to a location from their current location to a location where they can be repatriated. And those are the capabilities that exist within the Crisis 24 security team. And this is a third, again, protest Crisis 24 evacuation scenario 2021. In this case, there were two individuals that needed to be evacuated back to the U.S. It did require a fairly quick turnaround for air evacuation specific to their location. fairly significant, but quick turnaround, 36 hours for the full event. But again, lends itself to the value of intelligence and ground truthing of information prior to and during the process of an evacuation, because if ground transportation cannot be performed successfully, then there are other alternatives, but those alternatives are going to require different lead times and different capabilities for extraction. Next slide.
That's it.
All right. And I think with that, I can hand it over to you, Nancy.
Yes, and I'll invite
Yeah.
our panelists to turn their cameras back on. We have a few minutes for questions. We didn't get any in the meeting chat during the meeting, but at this time, if you'd like to if you have a question, you can take yourself off mute and ask it. Or if no one has questions, we're done with the end of our session, but we'll definitely stay here for the next 5 minutes to address anything that comes up, any questions that anybody has. And I'll thank all my panelists again for joining us today and sharing this information with us. So for everyone who's still on, just a reminder, as the slide tells us, please do complete your conference slide or your conference survey today when it's sent. Yep, it doesn't seem that there's any questions, so we'll just go ahead and end our session and everyone can get ready for their next session. Thank you again to the panelists. I really appreciate you contributing to our conference.
Thank
All right.
you.
Mhm.
Thank you.
Bye-bye.
Bye.
Thank you.